Hi, my name is Angie Knight. I'm 45 years old. I was diagnosed with psoriasis when I was 2 years old. My mom did everything to try to get rid of it, and I basically have had it for 43 years. It's centered on the back of my head, and I've tried every cream, everything known to man to try to get it to go away. Um, and that was a diagnosis in 1977. I was diagnosed with polycystic ovarian syndrome, and in 1999. I have not been able to have children because of that. They've tried every every drug they could to help me conceive, but it just didn't work. I was diagnosed with type 2 diabetes in 2000, insulin dependent after many tries with metformin and all other kinds of pills that just really screwed up my digestive system. So I was, before I started the patches, using about 30 to 40 units a day to control my blood sugar. That was a combination of fast-acting Humalog and 24-hour Lantus, which you take at night to help you when you wake up for your fasting sugar. In 2005, I contracted MRSA because I was a diabetic. My immune system had some issues. So I contracted MRSA, and I went through about 27 outbreaks, taking antibiotics every outbreak, until what they told me was I created a super force of bacteria in my body, and it just attacked my organs. It attacked, it was in my bloodstream, it was everywhere. So I was hospitalized for a month and a half. And for a month, I was in an induced coma. And they gave me a lot of medicine. They gave me amnesia medicine because it was induced. My brain had not shut down. So they give you the amnesia medicine to keep you from remembering the whole time you were in the coma. So that has affected my short-term and long-term memory. So that and also the heavy antibiotics they gave me has affected my my gut, as far as you know the bacteria in my stomach, everything has just got messed up. In 2010, I was diagnosed with rheumatoid arthritis. The doctor prescribed Humira, but I declined because I have a lot of cancer in my family. I was very worried that using the Humira and lowering my immune system would cause me to have, some type of cancer. So I declined that. I've been just basically living with the diabetes. I can't take any NSAIDs or pain relievers because I have kidney disease, and that was diagnosed in 2016. I have a diabetic retinopathy, which is like a symptom of diabetes. It's where the blood vessels in the back of your eye, they swell and they burst, and you get blood in your eye fluid. And if it's bad enough, you can go blind. And if it's bad enough, you will need to have laser surgery, or what I had in my right eye was a vitrectomy with an eye peel, which they go in and they suck out all the vitreous fluid out of your eye. They do some surgery. They peel the back of your eye and they take all of the gel out of the back of your eye so that you won't get any bleeding anymore, but it does affect your sight. So in my right eye, I've had that done, and my peripheral vision is very limited on my right eye. I'm trying not to get my left eye done. The doctor's been pushing me and pushing me and pushing me to do it for 2 years, but I just really am trying very hard not to get that done in my left eye. I have diabetic neuropathy, which it was diagnosed in 2017. It's mostly on my feet. The nerves get damaged, and then you can't feel the bottom of your feet. So it's really trying. You have to make sure that the bottom of your feet aren't hurt because you cannot feel it. There's times where I will form a blister and I don't know it's there, or I've dropped something on my toenail and I don't realize it until the day it falls off. And then I'm like, oh, something's happened to my foot. So that's interesting. And then in 2020, they told me I was basically starting to become a type 1 diabetic, meaning that type 2, your pancreas is still creating insulin. Type 1, your pancreas has ran its course and it's not going to create insulin anymore.
Then, so you have these things going on. How did you come across the X39?
One of my very, very good friends, Sandy Rencher, she reached out to me and said that her sister Shelly was using it and it was working wonders, and she started to use it. And I believe when you asked her, or one of the doctors asked her if there was anybody that she could think of, her first thought was me.
Yeah,
I was honored, but I was very sad because that means I'm like basically the sickest person she knows. But I appreciate her thinking of me, and she gave me 30 Alavita and 18 X39 patches just to start. And that's how I started it. And then just 3 days ago, I got my gold package with my patches.
So what has been your experience since you started wearing the patches? Tell us what's been going on since then. What proved?
During the 18 days that I took the X39, my insulin use went down from 30 to 40 units to a total of 20 units in 18 days. So
Wait a second. You were using 30 to 40 a day,
yes,
and then you only used 20 in 18 days?
yes,
Wow.
yeah.
So
And what I didn't want to do is go on a carb-free diet or do any type of help on the patches. I wanted to see how they would do if I did eat some good carbs, if I did try to eat healthier, but I didn't want to sabotage the patches by, cutting out sugar completely and stopping carbs and everything, because then I wouldn't have known if the patches were going to work or not. So, what I did is I definitely cut out white flour and white sugar out of my diet, just because if I'm going to use the patches, I need to give them a chance. And fighting against white sugar, white flour, all that is kind of ambushing them and expecting them to work miracles. So what I did is I got off white flour, white sugar. I still ate healthy carbs. And this is the result of that. I only took 20 units in 18 days.
Wow. Were there any other changes as well besides blood sugar?
Yes, the floating blood in my left eye was worse than my right because I've had the surgery on my right, but my left eye floating blood was pretty significant, and it was very difficult to see. It's really hazy when when the blood mixes in with your eye fluid, it
Sure.
becomes gray and hazy. So it was really difficult to see, and after I used the Alavita, the blood was diminishing. There wasn't that much swirling around anymore. I could see better. And the flashes of light and stuff like that were going away.
So you monitor your blood sugar all the
Yes.
time as a diabetic.
Right. I have a Libra sensor, which it's in my arm right now. And you just pass the tester over it and it tests your sugar. I don't have to prick my finger or anything.
And that's what tells you how much insulin you need to use.
Right.
Okay. Is there any other time that it's done this other than when you've been using the patches?
No, I've always attempted to go low carb and all that stuff, but when you do that, you go high fat. And high cholesterol is also a problem with diabetics. You get heart disease, your eyes will become just as brittle as everything else with high cholesterol. So, you've got to be really careful on what diets you use.
Okay.
I've tried the keto diet, but it was very entailed and very, you have to make everything and I work 50 hours a week. I can't do it. So, yeah.
So a woman with diabetes and rheumatoid arthritis and polycystic ovarian, and you work 50 hours a week. Well, I can't wait to see what happens when you've been using them for a year.
I know, right? I'm going to be unstoppable.
You already are. Trust me, Angela.